Hi, this is Andrea Rodriguez, and this is for Early Cognition and Education 1, Module 7 for Aspen University. Now, most infant auditory research has focused on infants' perception of speech. We have reviewed many of these studies that demonstrate that even newborns are capable of making the phonetic and other speech distinctions. Now, clearly, infants have auditory capacity to represent some of the critical acoustic features of the speech. The auditory system is designed to locate and identify sound sources in the environment. Sounds entering the ear are shaped by the structures of the outer ear to optimize the detection of the relevant sounds and also determination of sound's location in space. Now, the sound is then analyzed into frequency bands by the ear. These processes are likely to undergo important developmental change during infancy. It is important to recognize that attention, motivation, memory, and other cognitive processes influence auditory scene analysis, and in a very real way, the hearing. Now, these effects are described collectively as processing efficiency, and they contribute to the auditory development. Now, infants' accomplishments in the auditory domain are nothing short of just extraordinary. In the absence of the external guidance of reinforcement, those systems hone in on auditory development and our communicative capacity as we learn just complex information that is structured in the first postnatal year. Now, it is clear, however, that several aspects of hearing remain immature in early infancy, and it is likely that these immaturities do constrain speech perceptions to some extent. Now, these are just suggestions in literature that 2-month-old, for example, can represent speech with less details than an older infant. In likely aspects of speech perception, language learning are also delayed until about 6 months of age. Articulation refers to the way in which sounds, syllables, and words are formed from coordination of many factors, including movement of the tongue, the lip, the jaw, the palate, and even the breath. When considering whether or not poor articulation is a problem, there are two things that are important to memorize. First, it's not unusual for a child to have difficulties with at least some of these sounds until it unfolds. Second, standardized articulation testing and therapy is often not formally undertaken until the child is about 3 years age or even older. This is because at age 3, many areas of articulation consider development. And because engaging students' articulation therapy requires a child to have certain interests or skills that are not often present prior to age 3. Just as with motor milestones, where we expect a child to first sit, then crawl, then walk, there is a sequence through which sounds emerge as well. Just like the sounds D, M, B, P, they're all first consonants that will emerge. The sounds S, R, and I are often not completely mastered until the early elementary school years, and all those sounds are supposed to be mastered when the child reaches at least age 8. Now, just like learning any other repetitive muscle movement, learning new speech sounds is just like a lot of practice. Children begin developing these sounds right at birth through listening to the caregiver's speech. Now, when these babies start cooing and vocalizing those vowels and babbling, they're exploring the muscles in their mouth and at times attempting to communicate what their wants and needs are for the caregiver. From birth until age 7 to 8, children are continually gaining muscle memory, strength, and coordination for those speech sounds. Now, before babies learn to talk in real language, English or even Spanish, they babble and coo, playing with sounds. They baby talk. Now, baby talk sounds similar to the world sounds for all infants. But when you hear the baby's first words, critical milestones are learning to talk. And these happen in the first 3 years of life. When a baby's brain is rapidly developing during this time, their speech development depends on baby talk, as your baby will. The first baby talk is nonverbal and happens soon after birth. Your baby grimaces and cries. They're expressing emotions. They're also expressing those feelings of being hungry, being, needing to get changed. Parents learn to listen to those different types of cries. Now, just when your baby starts saying those magical first words, they greatly differ for any individual baby. At 3 months, they listen to your voice, they watch your face as you talk, and they turn towards those voices and sounds. By the end of the 3 months, beginning babies will start to coo, happy, gentle, repetitive sing-song vocalization. They really start mimicking what they're hearing in front of them. Now, at 6 months old, babies start babbling with different sounds. They might say bamba or dada. By the end of the 6th or 7th month, babies respond to their own names. They recognize their native language, and their voices are happy or upset. Some eager parents interpret stringing dada babbles as their first baby words. At 9 months old, these can understand no and bye-bye, and they also begin to use a wider range of those sounds and tones of voice. Most babies have a few simple words, mama and dada, by the end of 12 months, but they can also say please, thank you. They're learning those vocabulary words and expanding. Now, grammar development is a tool that children will be paying attention to as language starts to get more complex. This is how complex an adult or child's words, phrases, or sentences are. For example, the first step in English learners is combining two words together, like mommy up or I want. Grammar provides the building blocks for children to understand and express themselves in longer, more complex ways. When children increase these language complexities, their endings even change. They can express and understand more complicated ideas. The role in modeling of these languages is from educators that can foster these developmental issues, and they can also attempt to find if there's any developmental delays. These stages are also all done together, and it all works as a unit to provide children with their correct learning development. And I hope this enjoyed this video. Thank you.